everyone, and thank you for joining us for our next and final session in our Aging Strong and Falls Prevention series. And now I'd like to introduce our presenter for today, Debbie Lynn Toomey, RN, Coordinator of the Tufts Medical Centre's Injury Prevention Program. Debbie, thank you so much for joining us today.
Thank you so much, Becky. And I want to thank the Quincy Public Library for the wonderful partnership that we've had together during COVID to allow me to do my outreach work for Tufts Medical Center. I want to introduce to you Captain Tim Vamosi, and he's here because I heard him present in one of my statewide meeting, MASPIN, and he really inspired me to really think about prevention at the community level. He talked about the Easton Community Health and Paramedicine Program. And this particular program is a program that that involves not only the fire department, EMS, and so many stakeholders to be able to provide an amazing preventative program for the people of Easton. So Captain Timothy Vamosi, welcome. And before you say something, I want to give you a proper introduction. So firefighter Timothy Vamosi joined the Easton Fire Department in 2004 and was recently appointed to the position of EMS, MIH, and Public Health Officer in 2021. He brings with him over 20 years of experience in emergency medical services as an EMT paramedic and is also trained in family practice, infection control, and surgical practice as an MSN RN. His service also includes a position as a hazardous material technician for the Community of Massachusetts Department of Fire Services Hazardous Materials team, serving jointly as a member of the Joint Hazardous Incident Response Team. Whoa. All right. So you've got quite the background there and very, very impressive. And I'm sure once you present and share with us the program that you'll be talking about today, your background, your experience is going to really shine through. So can you tell us about your background? It looks like you're a nurse, you're a firefighter, you're an EMT. Can you just kind of start from where did you start and how did you get to where you are now?
Sure. Yeah, I mean, the short of the long is I started in the EMS realm when I was actually 18 years old in Brockton, inner city, working a very busy, robust EMS provider service. From there, went into the fire department, went to the fire academy. At that point, I was still in the military. So I deployed, went overseas, got injured, got back, had to kind of figure out what the next step was. So I used my GI Bill to go to college. And nursing was kind of a natural progression from being a paramedic, and went into nursing. And from there, I continued my education for a master's in nursing with a focus on family nurse practitioner. So when all of that wrapped up, we kind of had to take a look career-wise at we have a lot of education, a lot of experience with pre-hospital medicine. My nursing career took me into infection control, surgical, and family practice. And then we started to look at how we can take all of those disciplines and put them into a system that would best serve our community. Because I was kind of getting a view from both sides of the fence. I was seeing what's happening before somebody gets to the hospital and what happens after they get to the hospital. And the fire department as a whole has always been trying to get into the game of prevention. I think, the fire department back in the late 1800s, early 1900s, we saw a lot of fires happening and we said, how are we going to stop these fires? And we figured out, well, we can put rules, regulations, and fire preventative maintenance into building codes and all these things that didn't seem quite related to the fire service, but stopped all these fires from happening. And we saw fire fatalities drop drastically. Mm-hmm. In the 1970s, the fire departments got really involved into pre-hospital treatment. And we're seeing all these emergency calls, and emergency calls are going up and up and up. And we see all these horrible injuries and traumatic things happening in illness in the street. And we said, well, how can we do this? And then we said, well, we'll just follow the same path and start doing preventative medicine in the fire department. And hopefully what we'll see as we continue down this road is a drastic decrease in pre-hospital fatalities and injuries, and hopefully see a system-wide, is the goal, reduction in emergency room care, overcrowding in hospitals, these types of things. So hopefully catching things before they happen is the goal. Myself and a lot of other EMS stakeholders around the state have started to participate in Massachusetts Community EMS program. And I can just keep going from there if you want, and we'll get into the program and talk about it and how we got there. But basically what we did is we just found, we did a lot of studies with our local hospitals to identify areas where we might see need in our community, and medical needs. And then COVID hit. And so what we did is when we saw COVID hit, I think just about everybody in the healthcare community found themselves in a position we'd never been in before. So collaboration became key, and we were given the opportunity through COVID to really cement foundations between our partners in health that we didn't realize, or maybe didn't utilize as much as we do now, such as Board of Health, police departments, town administration, local hospitals, and incorporate them all into one big system of preventative health care for public health. And that's where community EMS really came about, and solidified those foundations, so that now in a quote unquote, hopefully COVID stable world, we can continue to address our public health issues as we move forward.
That's so amazing. Again, inspiring. I mean, that's one of the main reason why I asked you to come on is so that other neighboring cities and towns can gain some sort of inspiration from, your progress, the programs that you have there in Easton, and just to kind of at least get some best practices and get started in some small way, even though they may not have all the resources available. But to think about prevention in the community level in a way that's going to help prevent fatalities in the long run. And also, for the elderly, for people with disabilities, children with disabilities, et cetera. So really bravo. And I look forward to the presentation that you're going to be sharing with us. So if you want to start the screen share, so that way we can get that started.
So our program, basically what it did is we got together with our local hospitals, and we did something called the Community Health Needs Assessment. So we partnered with them. They do a study on our town and the town surrounding us. And we got lucky because they were kind of upping their trauma designations. So they were looking to do these studies anyway. So we kind of dovetailed into it. But we were able to get a kind of an idea of where our community stands and what kind of admissions are being seen regularly, what kind of needs may be out in the community through surveys and so on and so forth. So we had some evidence-based data to go off of. Outside of that, the state has also done some studies through multiple methods. And they identified a list of about 25 points that they were looking to address in community as well. And all that can be found on mass.gov. They have the whole list up there on our OEMS website, which is the Office of Emergency Medical Services. So we took a look at that list of what they're trying to fix, address in our communities. And then we took a look at our local aspect of where we need to address. And we came up with about 9 or 10 points that we were looking to do. And the first one for our fire department is fire prevention and burn education. This is something that we've done in the past through multiple avenues, like safety and fire education for our children. We have a Senior Safe, we call it, which is the same, except it focuses on safety for seniors. But we've expanded it a little bit where we can, outside of just doing burn education and fire prevention education, we can actually go out to the homes and do safety inspections. And if we identify issues, we can, something as simple as, changing out smoke detectors, installing fire extinguishing cans over the cooking ranges, two of the really simple things. And we also give away like oven mitts, and that kind of stuff. So those are some very simple things that we go out that actually go a long way because, as everybody knows, a lot of the fire fatalities that we see, especially in elderly, are folks without working smoke detectors. So that's a great way to prevent burns. So the home safety aspect, we actually go out and have a checklist where we go through multiple aspects of it, not just fire and burn education, but we also look for one of our biggest targets of prevention, which is falls. Anybody who's been in the emergency field knows that falls is one of our top, 5, if not 3 calls that we attend in the EMS realm, and they can be absolutely detrimental over age 65. So we really wanted to target that. We came up with this program. We have a checklist that was approved by a national entity called the National Fire Protection Agency, NFPA. And we go through a checklist of where can we see things that are trip hazards, power cords, rugs, making sure our hallways are clear, the space around the bedroom is clear, the path to the bathroom is clear. And if they need something, if a hazard is identified, we can discuss it with the homeowner, and we've partnered with our regional high school, which is a vocational high school, to help us install grab rails, ramp repair, all of these things. We've also identified volunteers in our community through local businesses, hardware stores, etc., that are willing to provide the materials for that, which is a great partnership we were able to do. So between the partnership with our vocational high school and the local hardware stores, it's been a really good thing. Again, this one's a little bit of a lift. It was one that I think on the surface looked a little easy to set up, but there's building regulations, there's building codes, there's home inspections, there's a lot of stuff that goes with installing any construction into a home properly. So anybody looking to get into this kind of program, it's definitely not impossible. It's very accessible. You just have to kind of pre-set up those relationships with the building department, inspection services, your regional vocational high school, and material providers. So I think it takes a little bit of legwork on the ground to get there, but it's a great program. And there's also the added benefit of COVID also isolated a lot of our elderly population. Probably the most dramatic isolation we've seen in that population in a long time. This program will get high schoolers out into the field looking to get into their own business or trade, and engage in relationships with the senior community, which is fantastic. It's a really big added bonus to that. For both of those age groups, I think everybody's been kind of apart from each other, and having high schoolers interact face to face in a professional manner with seniors, and having seniors build that relationship with youth is fantastic. So I was very happy with that secondary part.
And before you move forward, just a quick question. It looks like a very comprehensive program, and certainly I love how the high school is being incorporated in that, because during COVID especially, that helps with lessening the isolation, the loneliness that especially if people are living by themselves, right? And just having some sort of a group of people who are vested to make sure that they're okay during these really unpredictable times. So my main question is, who would oversee all of that production? There's a lot of moving targets there, and incorporating the visit. How long does that take? Is it just a one-time visit? Is there many visits? Is there like an overall case manager to make sure everything that has been deemed necessary are completed and done in a reasonable time?
Yeah, so that was kind of my position. So the town administration and the fire department identified this as an important part of where we're moving forward in our goals. So they actually made my position a full-time day position, and I guess I would be that coordinator. But again, this is a little bit more complicated than that. So we have more, it's really, I guess we're building it as a team-based approach. So where I might be the coordinator for the fire department side, where we can help identify people, we can help coordinate the work, the inspections, all that stuff. It takes a lot more people on, like, Council on Aging is another great resource, because they can often they get a lot of phone calls, and it can identify these persons readily. So my office is actually in the Council on Aging building, not in the fire department. I can literally walk down the hallway and get a list of people that may be in need, and then get weekly calls put out to these people to make sure they're doing okay through their various programs. We have a police department liaison that's coming on board within the next month or two, and their office is next door to mine. So if the police encounter something, that they can notify me, and then we can start the ball rolling that way and get the whole team involved. And of course, our Board of Health, our inspectional services, again, everybody kind of meets regularly to address these programs. I guess I'm probably the point person, but it really does take a little bit of time and a little bit of teamwork to make it all happen.
Thank
you.
And
we do that through regular meetings.
That's wonderful.
Yeah, it's a good system. And again, I think as we progress, COVID put a lot of this on hold. And I think as we move forward, we're hoping to really expand this out a little bit further. I think over the past couple of years, getting into people's homes to do anything has been a little problematic and cautious purposefully. Again, we're looking to really see this expand. But a good program. As part of that too, I think we had some pretty major storms over the past year with COVID as well. So we've had to expand our emergency preparedness to make sure that our elders and seniors are ready for those kinds of things. And that was really just purchasing things like flashlights, making people aware of reverse 911 system, which is where we can actually put a message out to them in case of emergency, instead of them having to call us, storms, power outages. And we actually have a whole emergency management team that works on this. And we have a community resource called CERT team, which is Community Emergency Response Teams. And what they do is they set up shelters and so on and so forth. And they go through a lot of training for how to take care of elderly in these situations, and how to remove them from their homes, get them to shelters. And again, that's a partner work with a lot of people. But the basis of this is just to kind of make sure that they have communications and are safe during a storm. They can get a hold of us. Windows fall prevention, we just that's part of our safety check, where we go in to make sure everything's free of obstruction. And of course, that's in case of fires, making sure they have proper egress, and trips, slips, trips, and falls around window areas. Sharps awareness was another big one. I know, the opioid epidemic has not faltered throughout the pandemic. So our Sharps awareness program was actually trying to address a couple of issues. One was the opioid epidemic, making sure there was a safe place for disposal of any of those Sharps that may pose a danger to the public. So we now accept Sharps for no charge to our residents. They can come in, drop them off in the box, and walk away. We have a kiosk in the station now, so that's free. The other thing is it costs a lot of money to get rid of Sharps, and we understand that that's a pretty heavy demand, and it's a part of healthcare that a lot of people struggle with, especially in the senior population, where there's a lot of injectable medications now. They have to have a way to dispose of it, and the disposal costs can be quite expensive. So we took that on as a community to address that. We didn't want Sharps ending up in the trash or getting improperly disposed of, or somebody storing them in their home improperly. So we decided to take that on. It was a joint collaborative with the Board of Health. And I think we started this in around September. And to date, we've collected well over 200 pounds of Sharps for proper disposal, which is great. So that's a really big thing. And with the opioid epidemic side of this, we also provide pamphlets and education for anybody who's looking for it at the time of drop off. They can just knock, no questions asked, give some information. And we try to set them up with our oncoming police liaison, who also is a social worker as well. So we can provide whatever they need on that aspect in terms of opioid use. So a good program, again, still in the works. I think that one's hopefully going to expand a little bit and address more issues as we move on with our police liaison social worker. Homelessness and housing instability. This one is a really big lift, and I think it's one that you definitely have to partner with your Board of Health. But this encompasses a lot of folks. So in Easton, we have Human and Health Services, and for anybody who's dealt with elderly, unsafe living conditions, unable to care for self in their homes, That would be somebody we're going for multiple frequent falls at, or just basically unsafe living conditions in a home that's in disrepair. And hoarding is another one where we have to address that. So there's this one is a bit of a bigger lift, but it involves a lot of people. So we have our veterans agent involved. We have our housing authority involved. We have Human and Health Services, Board of Health, police, fire, sometimes DPW. We have state agencies involved, hoarding task force, and we had to partner with a lot of elderly service providers, the biggest one being Old Colony Elderly Services. So basically what we do is we go into these places and on the 911 side, we'll frequent a particular address 2, 3, 4 times in a week of somebody having frequent falls. And it used to be where we would just go there and, help them up, put them back to bed or transport them to the hospital. But the hospital is not always the best place for these folks. And especially during COVID, sometimes it was just an unsafe place for them because of the risks of going to the emergency room and contracting a sequomial disease. So we started to think, what can we do? And we started communicating with elderly services that come to the home and basically just acting as the intermediary between, look, we've identified this person. And so if the on-shift firefighters identify a home where there might be an issue, they notify me. And then I will go out and either door knock and, cold knock on the door. Hi, I'm from the fire department. We've been responding here. Okay, is there anything we can do to help you out? Or they'll offer these services on scene with that person at the time of a fall. So they'll say, look, you might not have injuries, but you're falling frequently. We don't want you to have an injury. Are you willing to meet with our community EMS officer? He'll come down and meet with you. And then I'll go down and meet. We have a chat. We talk about what kind of services we might be able to bring to them. And a lot of times those services come out and they'll get either nursing care, home care, even just medication delivery care. It's really incredible, the services that are out there. So we've actually compiled a big list of folks that we use and identify, and they go right out to the home, and we can actually see those numbers drop where we're not responding to that home 3 or 4 times in a week. And hopefully that is a display of a reduction in injury potential. So it's a really neat program. It had to involve a lot of people. Again, that one was a little bit of groundwork to get everybody on board, but it's been actually working out very, very well. And we see this more often than not in our elderly housing communities. But they've actually put Old Colony Elder Services in their housing authority. So their office is right down there. So I can take a ride down there. We can both go to a department and address the issues and get them taken care of. And it's been really, really good.
And before you move on to children with special needs, just going back to evaluating the home for safety, homelessness and hoarding and fall preventions. There's a lot of money that looks like it's being invested in making sure that people have the proper grab bars, or they have the proper means to get out of the house properly, making sure everything's safe. And if they have hoarding issues, is there also mental health that's going to be involved? Who pays for all of this? And where does the person's insurance kick in? So that, the proper services are provided for these people.
Yeah. So, the town had to make a commitment on our part, where we invested into the staff, labor costs, and time that goes into that. So the positions that we put into play were provided for by the town. When we get into, so we're still fairly new to the program. So we are looking for grant opportunities is our biggest probably money draw right now. And so a lot of this material-based items are through grant and grant procedures. Our staffing has been just through our regular budgetary process. And then for a lot of the programs that we use, we rely on pre-existing programs. So like I said, the Old Colony Elder Services will come and meet with them, and then they have a whole bunch of folks that they say, okay, we can identify these things, and your insurance is going to cover these things, and out-of-pocket expenses might be this. And we can partner with those agencies, and we try to use as many state agencies as possible, because usually those are the ones who are very familiar with the process and what they can use for, Mass Health, Medicare, and so on and so forth. So finding programs that are first off approved by all those agencies, so that they're capable to provide services in the proper manner is important. But again, that's through that pre-screening process when you partner with these entities, making sure that they have the means necessary to make sure that they include things like healthcare and those types of things. It's not all out-of-pocket costs.
And besides people that you typically get the 911 calls for, the ones that you would probably put in your priority list, how do people 65 and up, if they want to get involved in this program, are you asking them to sign up, or is this program purposely getting in touch with everybody who is at a certain age and up to make sure everybody's covered?
Yeah, and that's again, it's all about partnerships. I'm going to say it 100 times. It's really great with Council on Aging as our primary advertising source, or marketing source, if you will. So again, the hardest part of this is getting the information out there. So we've held information sessions. We've done programs like this locally, and we try to reach out as much as we can to let people know that they can come here and access it. Making every department aware of what we do is also extremely important. So resources that you wouldn't think of necessarily as being for the elderly, but like a school system is a huge marketing tool for us in a local town, because it has access to so many families. So just getting information out through the school programs, participating in health fairs, making yourself accessible to the Council on Aging and Board of Health. A lot of times those outside departments will identify a lot of people that could use the program and bring it to us. And then they'll identify it to us, and then we go after it from there. But it's really that they're keeping that open mind and taking every advantage you can through every department, not just your own. If we try to do it alone as a fire department, I don't think it would work. You really have to have strong relationships with every department in town, and make yourself available to them as needed. So it's we capture newsletters. There's so many avenues that it goes out through. That's kind of the base of it there.
And do you have services for people, non-English speaking people?
We do. So our human and health services, we have translator telephone applications we use. It's not the best, but it's what we have, and we work with it. It's very good when we need it. So we try our best to do that. We're getting into a lot of our educational material. We're starting to print in multiple languages. And again, the state's a great resource for that too. They have a lot of material for budget conscious towns like ourselves. I think everybody is. Where we can get multiple educational resources in multiple languages from the state through their from what they provide. So while it might not be specific for the town of Easton on there, it will still cover fall prevention. It will still cover newborn nutrition and all these things that we try to address.
Wonderful. And I'm assuming also that you have the same thing for people who are visually impaired and also hearing impaired.
Yeah, we have some. Again, this is where we get into using the resources from different areas. So if we run into those types of issues, we can tap resources from school department, from Board of Health, from Council on Aging. So it might not be necessarily the fire department that has that, but we can utilize the technology from a town-wide perspective where we can bring those things in. So we have the teleprompter phones that actually type the text and that kind of thing for hearing impaired and so on and so forth. So again, I don't think it's one thing that one department can necessarily lift and pick up like all of the costs for all of the technology we need, but utilizing the resources from every department has been how we've been able to succeed in those areas.
Thank you.
And I'll briefly go over these last points. This is another program that's fairly simple, and I know it's labeled children with special care needs, but it really does apply to anybody in town. We've expanded it to not just one particular age group. However, children with special care needs was our target population to really get at them. But this does apply to anybody with any special Medicare needs. And basically what this is it's a very simple system where we use our higher end technology and our dispatch and computers in all of our apparatus. And that includes police cruisers, fire apparatus, ambulances, fire cruisers, so on and so forth. And we use something that's a low-tech method of technology, which is a simple notebook. But basically what happens here is we advertise out to the town, and we say, is there anybody out there who has any special medical needs that we may need to be aware of as first responders? And they reach out. We set up an appointment. They meet with me or another paramedic who's trained. And we go through basically a very simple system where they take a 3-ring binder that has a demographic information, medical information, all spelled out for them. They take that notebook back to their specialty care provider. Their specialty care provider fills out the standard form and brings it back to the fire department. We upload that into our dispatch system. And when we arrive on scene, it basically informs the crews of what's going on before we get there. So if it's, a pretty clear example is maybe a family with severe autism in the family might not want an approach with lights and sirens. It's a very simple thing that can really settle down a 911 call before it even starts. Or if they're in the middle of a crisis, we want to make sure that we don't continue that crisis in a negative way, but help to mitigate it before we even get there. So simple things like that can be in there. But the other thing that is really important is when somebody has a lot of special medical conditions, it takes time to communicate that when you're on scene. And we're not always granted the luxury of time on emergency scenes. So what we'll have is we'll have an entire plan for that patient before we arrive as to what hospital they need to go to, where their specialty care physician is, what instructions they have, special medications that we have to get approved through our medical directors. All of that stuff can be done before we get to scene. And that way they can just transfer a binder over and take that binder with them to the hospital so that when we get to the hospital, all of that information is concise, clear, and ready to go to the providing physician there as well. The other bonus to this is we put it on a USB. So if they want to keep the binder in their home, they can give us the USB. We can take out the hospital and the patient records will be there for them as well. So on the surface, it sounds a little complicated, but it's really just as simple as taking a little time, a little bit of paper, and a USB to get that pre-communication set up. But it's really very helpful for the families of anybody with any special Medicare needs, medical needs. It's a fantastic thing because it really improves our on-scene time, gets them to where they need to be safer and faster, which is a nice thing. And so we've done this with cancer patients, especially with our proximity to Boston. We're about 20 miles from Boston. So a lot of people choose our community because of where we are with all these specialty care facilities in Boston. It allows us the freedom to take them where they need to be to receive the care that they need. So it's a really, really kind of a neat program. And it's fairly low cost to get off the ground.
I really love the binder system because I can even see the benefit for the older population to have something like that. Putting their medication lists and their allergies and their doctors, the hospital they typically go to, because again, if they may be living alone, and for, during a crisis, an emergency situation, it's hard to voice all of those information. So having a binder like that, a go-to binder would be so amazing for so many people.
Yeah, absolutely. And I think File a Life is probably the most recognized system out there. We use that as well. It's basically just a little sheet of paper they put on a magnet and throw in the refrigerator with all their healthcare information. The benefit to this is, especially for elderly populations, and again, specialty care, when we get into specialty medications, specialty mechanical systems for medical needs, such as like in-home dialysis, LVADs, left ventricular assist devices, a lot of these very specific ventilators, a lot of things that come out there where family might not be able to provide what they need there. We can come in with that binder and we can have them pre-approved so we know where they're going to go. So it's a little bit of a step beyond the File a Life, which is familiar. So we run blood pressure clinics weekly with our elderly community, where we screen blood pressures weekly and get in communication with their cardiologist and so on and so forth. While we do that, we also distribute these materials, which has also been very helpful. So everybody that comes in for a blood pressure gets a File a Life. And if we identify, oh, you have actually a specialty care, let's get you to the next level and go to this program instead. So that's another great way, another key way of getting people involved in the program. Child passenger safety. This is another great one. We've partnered with Boston Children's Hospital Injury Prevention Program. They bring down car seats. We do a class with the community. We've actually, I think today we've probably put out 40 to 45 car seats into the community free of charge. They come in for a class. We also have certified firefighter paramedics in our department as car safety seat technicians. And we're going to be hosting those technician certification classes in Easton as well to get more people out there that can put these in properly. But this is a great program, and it's not just for new parents; it's for grandparents, it's for everybody. Any guardian of a young one that needs a car seat is still within that age frame. But we do a lot of there. It's been a great program. We've been very excited with. Another great way to get folks in the door and go from there. Vaccinations, I'll kind of breeze over. COVID-19, I think everybody is well-versed in vaccinations over the past year. But part of our community responsibility here is to make sure that all of our paramedics are trained and able and have access to the ability to give vaccinations out to our community. And as we move forward from a COVID perspective into flu prevention, so on and so forth, we'll be looking to use those vaccination skills that we learned during COVID and got certified in for general illnesses as we move forward. And the last one that we have on here for today is the Welcome Home Initiative. This is one that is kind of unique for Easton, but it's, again, having to do with infants. Basically, what we do is within the first 8 weeks postpartum, we can meet with new families and postpartum or adoption, I should say. We'll meet with the new family and make sure that they have all the resources they need in their home. So we'll meet with them, go over a checklist. We have a standard form of questions from the state that we use, and we just basically make sure they got what they need. And if they don't, we make sure they get the resources to them. This one came about because we have the opportunity to deliver babies from time to time, and it's one of the things that we very much enjoy in the fire department. And a lot of the times after we deliver the baby, we take them to the hospital, our responsibility ends. But we put a stork on our truck every time we deliver a baby. So every time someone's delivered in our town, it's a lifelong attachment for us to them. And we wanted to make sure that we make that they have access to everything they need to live a happy, healthy, and safe life. And again, this is based on preventative medicine. We want to make sure that we get families in the early stages to make sure that they have healthy, nutritious food, accessible and proper health care, so that as they grow, a lot of those disease processes that can start early are prevented. So it's another way to catch things early. But that was kind of the last one there.
Yeah, I wish I had that Welcome Home Initiative when I had my first son, because when it was time to go home with my first child, my husband and I were like, "Are you sure?" To the nurse, "Are you sure we're ready?" And boy, as a young family, it was just very scary to be in charge of that little baby and to make sure that baby is fed and taken care of. And oh boy, it's just it's a very scary time. And maybe, I don't know if that Welcome Home Initiative also is linked with the La Leche League for mothers who are breastfeeding.
Yeah, so we've actually partnered with our maternity services at our local hospital, where, again, I'm trained as a nurse. I went through my maternity rounds just like everybody else, and OB rounds, and when I did my FNP, I did all that stuff. It wasn't necessarily the practice for me. But it allowed me the opportunity to build a lot of relationships. And while I might not be the best lactation consultant for a family out in the field, our goal is to go out, and if we identify a nutritional need, to get breastfeeding out there. And we can also hold seminars in our town. We can do community education. We can do all these things where we're happy to host those types of events to make sure that the people know that everything out there is accessible. We just want to kind of be the link in between. So yeah, it's an exciting program. And then again, once you get them in there for the first 8 weeks for that, we can identify, do you need a car seat? And we'll get them into car seat class and get them a car seat. And as the child grows, we'll get them a booster seat, and so on and so forth. So we're trying to establish as much preventative care as we can prior to the 911 call.
Thank you so much. So as far as, I love prevention. And why do you think that there's just very little vested in prevention? I mean, the society seems to do a lot of, we react to a crisis, to an emergency. And then, sometimes there's fatalities and there's just so much cost, time and money and lifestyle. And there's just so many costs to a crisis. Why do you think there's little attention on prevention? And what can we do in our roles, do you think, that can really help people realize how important prevention is?
Yeah, I think it comes down to the old adage where it's difficult to sell savings. I think for the most part, society is based on having tangible in hands end product. I think from a fire standpoint, we saw house fires happening. We saw fatalities go up and up and up and up. And we started looking at it being like, we're really tired of, seeing people pass away from something that may be preventable. And then the question came up, well, how do we prevent it? And then over years and years and years of going through construction material and different things, we kind of founded these ways to reduce fire risk. And then we saw a drop in fatalities. I think in the emergency medical services, medicine's as old as time. However, emergency EMS really didn't come about in the communities until about the 70s. So we're actually, when you compare us to standard hospital medicine or in-hospital medicine, we're very, very new. And so we're kind of on that cusp where we're saying, okay, we're looking at all these traumatic injuries, all these falls, all of these life-threatening illnesses that we can see in the field pre-hospitally. And now we're starting to see the costs associated with it. So I think we're going to start seeing fire departments and communities as a whole look at that and say, what can we do to prevent these things? COVID, I think, unfortunately, really put a spotlight on out-of-hospital preventative medicine. I think we saw a medical crisis where hospitals were overwhelmed, and rightfully so, during a pandemic. And it really fell on the healthcare community as a whole to take a look at how we're doing things and what can we do better to prevent illnesses before they occur. So there were other fire departments around us that were doing even expanded medicine out in the fields. We were doing ultrasound on lungs. We were doing COVID home visits. We were doing a lot of things, not particularly in Easton, but in fire departments around us. And it kind of put a speed up to that process. So I think it's going to take time. I think it's going to take a collection of data. I think, in medicine, we try to do everything on that evidence-based process. And we're at the beginning of a lot of these changes. So I think it's going to take us a little bit of time to collect the data we need to continue to move forward. But I think that falls on the shoulders of a lot of EMS providers, a lot of ambulance services to kind of go after these kinds of services, start collecting that data, collaborating with each other, and then finding the process of moving forward.
Yeah. It's just so amazing. I mean, the program that you just shared with us is just so amazing. Where do you see it expanding this year and maybe next year?
Yeah. And I want to preface this too. I keep talking about teamwork and how we did this. A lot of the services that we provide were a collaborative effort between a lot of communities around us. There's not just one paramedic. I mean, I'd love to say I came up with this and it was my idea and I'm champion of it. But the reality is we've all kind of talked to each other. The fire department is fantastic about sharing information. So if anybody's interested in it, reach out to me. I'll share what I have. Because I've gotten a lot of what I did, we accumulated and put it all together and share with each other.
Yeah.
So over the next year, I hope that continues. That's really one of my big goals, is to advertise this program out there, continue to collaborate with my coworkers and get information out there and receive information from them to see what I can do better to improve. In terms of what we're doing with our program, COVID put a damper on a lot of things we were trying to do. Getting into the home was difficult. So we're going to try to expand on what we're doing right now and really get into more homes and access more materials and really try to get the program out there in a more sustainable way. Grants are great. We're happy for them. We're going to keep applying for them and keep grabbing as much money as we can that way. But trying to find a way to make it socially sustainable and fiscally feasible is another big goal too.
Yeah. COVID did change a lot of our practices and the way we do things. So definitely, we need to be able to work through these times and also be able to keep it sustainable. Definitely. So I'm glad you mentioned that you want to make sure that other communities, try to do something similar and to reach out to you. Because again, this is the whole reason why I wanted you on this program, to really bring awareness to the fact that there's something such as your program, the program there in Easton, it's happening, and to borrow best practices, or maybe, copy the same thing and collaborate with you guys so that their own community is also taken care of. Again, just the preventative part of our way of living is just so important. And COVID certainly has proven that, wearing a mask and washing your hands and just distancing yourself, prevention is so key. So let me ask you, so now a lot more people are aging in place, and I'm sure you're seeing more and more older people, again, maybe living by themselves. They could be widowers, or maybe they were never married or divorced. How do you go into a home? They may live in a two-family home, and maybe they've been living on their first floor, or maybe have been stuck on the second floor. Where do you start offering help for those individuals, and how does fire prevention fall into that? And also being able to, I know might be tricky, but how would you instruct that person to be able to get out of a burning house easily and safely if they could?
Yeah, I mean, so I consider myself very fortunate in the fire department. And as a healthcare provider, we often meet with people in the most intimate of times in their lives. So while somebody might not necessarily reach out for help to, let's say, Board of Health for an issue, or to Council on Aging, or many of these other folks, the fire department, we're there when they need it the most. So we have access to their homes. We have access to them they're not coming to an office setting where the practitioner has to kind of interview the information out of them. We're going into their homes so we can see what they're experiencing and be with them in that moment, and kind of reach out to them when they need it the most. So the fire department has worked very hard over a long, long period of time to establish a strong relationship with our community. And in Easton, I have to give a shout out to the folks I work with. They do a fantastic job of our customer service and interacting with the public. It's a very, very important part that they have it. This relationship only works if they have trust in what we do. So kind of coming in with a uniform, a badge on, and an established trust where they know that they communicate with us, and it's safe for them to do so, is extremely important. But it gives us that access. And again, we can go to somebody who's had multiple falls, and the last thing I would ever want to do is remove somebody from a home where they want to be, and where it can be safe for them. But they might communicate to us, I need help. And then these guys recognize that, they bring it to us, and then we follow up on that help. And I think that's the next biggest part of it. So then we can identify all of those additional services that they might not necessarily reach out to on a regular day-to-day basis, and get them involved in a lot of systems that they probably didn't even know exist. One of the most simple ones we have is we have a volunteer in-home call service for our elderly. So sometimes people call 911 just because it's dark and scary and lonely out there after a long time of isolation, which is a fantastic thing to do. I'm not disparaging that at all. Well, we go out there and we just have a talk with this person, make them a cup of tea at 3 o'clock in the morning when they're lonely. But that might not be the best way for 911 to address that. What they need is continual care. So then we can refer them to our Council on Aging, where a volunteer will call them 2 to 3 times a week just to have a conversation. Just to check in on them. And it's a great program. One of my favorites out there, and it makes a huge difference in what they need to do, because my guess is they don't want to be calling 911. That's not what their goal is. Their goal is just to be safe and secure in their home. So I think we're very privileged as a fire department where we can go out and kind of make those introductions and do that. The other part of it is training. If anybody on the fire department is listening to this, that's the keystone to everything that we do in the fire service, medical services, all of us, we all train. So making sure that our departments are trained up, that our paramedics are knowledgeable and aware of what we're doing and how we're doing it and where to go and get that information. I'm not an expert on many things, but the key is just building relationships around us, making sure that people are aware of it and communicating those needs properly to the people who are experts, which again is another, I think something as medical practitioners, we've really changed the model from one doctor kind of handling everything to referring to specialty care and having multiple specialists in a teamwork-based approach to patient care. We're bringing that model right to the fire service. We're saying, look, we just need to identify how many people we can bring to a wraparound service to make sure this person has all the care that they need. And that's kind of the end goal. Now, can we do that in a year? I don't know, but hopefully we can start with the first 911 call into the home, make those identifications, and then get them services before we get that next 911 call.
Yeah, definitely. The team-based approach is good, but the key is communication and accountability, right? Yeah. So, can you just share a little bit about the training that a volunteer person would have to take in order to be a volunteer to call people at home? Do they need some sort of a background check to make sure that they don't have any criminal records? Or, do they use a different type of phone system? How is that done so that there's no abuse of any type of calls from the volunteer part?
Yeah. So one of the teams that we use is our CERT team. They don't necessarily do in-home calls, but there are shelter people. They're the ones who go out into the community and do a lot of our volunteer aspects with the elderly. They go through actually an academy where they come in and they go through like a whole orientation session. They go through a training session. They're trained in basic first aid. And then they have to go through background checks, query checks, all of that stuff as well. And they have monthly meetings where they all get together and they train monthly on different aspects of what they can do to help out the community. So anybody that we put forward facing with our elderly community or our child community, they have all of those things in place. So we try to provide as much training as we can, and checks and balances in place before we get them out in front of our community. But I think, preparation is key for that. Really making sure that everything's done prior to is important.
Wonderful. I could really see the benefit of that. Just, when COVID hit and I was not able to do my in-person programs, Aging Strong used to be and still is an in-person program where I talk about fall prevention, but then like everybody pivoted and, found ways to be able to still continue to do the work and share the basic messages. So I remember I wanted to reach out to past participants just to see how they're doing and just to, maybe 5-10 minutes of, hi, how are you doing? And do you have any questions? Are you getting out there, getting some sun? And, do you need anything? Just somebody who knows them and who cares about them and just making sure that, they're doing okay. And boy, was that ever appreciated. And you can pick up energetically or from their voice if they felt okay, or they're busy doing something, or maybe they were really scared. So there's a lot that can be picked up on that very quick, short phone call.
Yeah, and then another one of our most successful programs we've had is probably one of the easiest, and it's a blood pressure clinic. What we do, actually, we do diabetes as well. We check blood sugars, but we just put our paramedics out there, and it's 10 to 15 minutes of FaceTime with a person who has been in isolation, and we take a blood pressure. But as any healthcare practitioner knows, when you're taking a blood pressure, you're having a conversation, especially with senior folks. But it gets as complicated as we want or as simple as we want. But we check blood pressures, we track them for them, they take them back to the cardiologist. But we also ask, are you taking your medications regularly? Medication reconciliation is huge in healthcare. So just asking that question once a week, are you taking your medications? How's that going? How are you responding to those medications? Making sure that did you eat today before we take your blood sugar? How many meals have you had in the past week? These little simple questions can lead down to drastic life-changing roads. But I can think just off of hand of about 4 or 5 patients that I see weekly that have started antihypertensives, and they haven't been transported to the hospital since we started doing these clinics. And those kinds of things, it keeps them out of the hospital stays, keeps them with their families where they're supposed to be, in their homes where they're happy and safe. And the best part is, as first responders and practitioners, we know that they are safe, and that's the key. But just those little questions, a conversation can really turn around somebody's healthcare and prevent a lot of issues from occurring.
Yeah. I mean, there's good point about the blood pressure clinic, because I've been doing that as well. I mean, in just a very short moment, you could see how a person, how they walked into the room, how they're sitting on the chair, how engaged they are, just the energy that they have when they roll up their sleeve, or if they have, long sleeves. Just there's so much assessment that we could do head to toe real quickly. And we're there just to check the blood pressure, right? But we're able to assess fall prevention, how quickly they can get up from the seat, how, if they need a walker, or, if they're walking away from their cane. So many assessments that we could use, that we could do in that brief moment of just checking the blood pressure. Love it. So we're almost at the top of the hour. Can you give us like one or two key takeaways? If you were talking to different cities and towns, and this program has been downloaded by other cities and towns in Massachusetts, thank goodness. If you were there to talk to the fire department or maybe the police department, what would you share with them so that way they could start initiating some sort of, how can you plant seeds into their head that this is possible?
Yeah, I think, number one, I think you have to sit down if you're on a fire department, police department, anybody that works with community, board of health, any of those departments. I think the best place to start is a community department head meeting. Get everybody in the same room, figure out what your goals, expectations are, and start there to make sure that you have that beginning of relationship. Again, I think a lot of towns and communities were forced into this during COVID, because that was a massive team effort to get COVID addressed. Don't lose that momentum. Keep everybody in the same room over and over again. Start identifying other public health issues that may be preventable, and again, fiscally feasible. I think is a good way to start. Making a strong relationship with your local community hospitals is extremely important, because it's all connected, right? I think they're trying to initiate the same programs we are, and if we're both on the same page working towards that same goal at the same time, it's going to be a lot easier. And then lastly, lean on each other. I think it really does take interdepartmental buy-in and collaboration, but also multiple towns can collaborate with each other. I definitely didn't get where I am right here without calling a lot of fire departments around me, being like, what are you guys doing? How are you doing it? What can I do better? And then a couple months later, I'll get a phone call back saying, how'd you make out? What can we do? What are you doing? So keeping that line of communication open with each other to really utilize a statewide system is going to be key to its success. And then just staying engaged. Don't be afraid to do it, I think, is the big part. It does take a commitment of time. It does take a little bit of a financial interest to get there. But I think when you get out there and you start doing it, you find out that the simplest things, like we just talked about, a blood pressure clinic, start small, make your small goals that are achievable, and start hitting those on your weekly. And then plan for your bigger goals down the road, if you need to, for a year out, 2 years out, and then start chipping away at them as you go with the smaller programs. But I think even the smaller programs can have a much bigger impact, at least from what we've seen, than even what I originally anticipated. The simple things like the car seat program, I'll be honest, I really didn't think that was going to take off. I was like, well, I don't know. People need a car seat, they go get one, right? It ended up being one of our biggest draws. So you never know. So don't be afraid to throw it out there, see what hits and see what flops. But and then share that information with everybody, collect some data, and let's get some more funding out there as we go.
Yeah, thank you so much for thank you so much for being on. I've learned so much, and I hope people out there who are watching can gain, lots of valuable information and also inspiration from what you just shared with us. So again, thank you so much for being here today.
Well, thank you for having me. Thanks for having me, and thank you to the library as well.
Yeah, and what's the best way to reach you in case somebody does want to reach out to you?
Yeah, so we have 2 entire websites dedicated to our program. One's on the Town of Easton webpage, where you can find us under community and community health and paramedicine. And then on the Easton Fire Department webpage, there's a link to my email there as well, where you can email me directly, and I'm more than happy to share any information I can to be a help.
Wonderful. Thank you so much, Tim. Thank you to Quincy Public Library and, of course, QATV. Bye-bye now. Take care.